I just came back from the dentist. I had a big chunk of my tooth sort of chip out, so I'm currently all frozen up. Hard to feel it here. It's actually funny, even extending up here to my eye. In today's video, I'm going to be showing you 5 simple things you've been giving to your pet post-surgery to help them speed up clearing that anesthesia. This is Dr. Andrew Jones. In my YouTube channel, I discuss natural remedies that you can use at home to help your dog or cat. If you like what I have to say, I'd sure love it if you'd click down there and subscribe to my channel. So I seem to have this thing with dentists and my teeth, and I seem to perennially be going back to the dentist. Which also means I'm getting anesthesia. Which means I'm thinking, maybe is that too much anesthesia? Yes, it is local anesthesia, and I used to tell pet owners, don't worry about it. You know, you've got healthy functioning organs, and in particular your liver. Your dog or your cat's just gonna quickly clear that anesthesia. But I've had bouts and bouts of especially local anesthesia, lidocaine, which has had me thinking, there's something else I can give myself to help, get rid of this a bit quicker. So the first big thing is just adequate hydration. First of all, I'd expect that your veterinary clinic, while they're doing the procedure on your dog, they're going to have them on IV fluids. I'd actually encourage you to insist on that, especially if you're dealing with general anesthesia. Secondly, when they're coming home, we want to make sure that your dog or your cat is taking in as much fluid as possible. The second thing I'd have you consider is ginger tea. So what I've got here is this ginger root here. I've made myself up. I'm going to use it right now, some ginger tea. So it's cooking in there, which means I chopped up about a tablespoon of ginger, and I put it in 1 cup of water. The ginger simmered for about 20 minutes, and I'm just gonna put it in a little press here. About them. You can also just use a sieve or something to strain out the big chunks of ginger. And there it is. There's the ginger tea. We're looking at doses based on that recipe, about a teaspoon per 10 pounds of body weight, 2 to 3 times a day. And I'm giving it for 2 reasons. The first big thing is that it's anti-nausea. So many of these guys, they feel sick post-surgery, and having that anesthesia is going to help them potentially feel better. I know I don't feel 100%. Secondly, it's thought that ginger is also supportive for the liver and liver health period. It's combined with many of these things such as liver detoxes. But in particular, we know it's got some good properties in it that is supportive of liver function, and that's what the big organ that we're trying to support post-anesthesia. Cheers. The third thing I'd have you consider is probably the most important herb that I'm going to mention, is this here. It's milk thistle. So milk thistle, of all the different herbs that I mentioned, is the most important one to support liver function. We're looking at doses of about 100 milligrams per 10 pounds of body weight daily. So this one here is a 500 milligram capsule, which and this would be Pippi's dose. You'd be getting a 500 milligrams of milk thistle. I would give that twice a day. Post-surgery, I would give that somewhere between 5 to 7 days. Will it do any harm? Not at all. Could it potentially benefit Pippi in a big way in terms of supporting her liver function, helping her clear that anesthesia quicker? You bet. The fourth thing I want to mention is another herb that's pretty important also for liver function. It's dandelion root. So dandelion root has a variety of different benefits, but in particular, one of the primary one it's been used for is supporting the liver function and liver disease. Majority of the time, if you get the tinctures, it's going to be primarily the dandelion root. Some have some of the dandelion leaf, and that would be fine. When you're looking at a tincture dose, you'd be looking at about a half a mil. Just try to show you on here. Okay. That's about a half a mil per 20 pounds of body weight, and that would be given twice daily, somewhere between 2 to 3 days. It's just meant for short term. It can also be really beneficial in helping clear that anesthesia a little bit quicker. The fifth herb I wanted to mention is curcumin. So here is some of it here. And in particular, we're looking at this one, which is the 95% curcuminoids. Generally, if I'm would be suggesting that you give curcumin, we got either one, you had a dog or a cat that's had anesthesia, where you know they have a compromised liver, and or they've had repeated bouts of anesthesia. And we know in particular curcumin has a whole variety of different benefits, but specifically for liver disease and supporting liver function. When you're looking at doses of the 95% curcuminoids, we'd be looking at somewhere between 50 to 100 milligrams per 10 pounds of body weight daily. So something like Pippi should be getting about 500 milligrams. And these capsules here, assuming I can read them, are about 400 milligrams. So you should be getting one of these capsules a day. And I would be giving it anywhere between 7 to 14 days. Thank you for watching this edition of Veterinary Secrets. First, I want you to click down there to like this video. Click right over beside it to subscribe to my channel. And lastly, I'd love if you would sign up for my newsletter, and you can do that by clicking that link directly in the box below. And then I can send you my free books and my free videos on how to heal your pets at home with my top natural remedies. You've also got to give a thumbs up to Pippi.